Hello everyone, my name's Carla Macias, and welcome back for another episode of Best Docs Network featuring Forest Park Medical Center. The Best Docs Network show is dedicated to helping people find the right doctor right here in the city of San Antonio. On today's show, we'll be giving you an exclusive look into some of the amenities featured at Forest Park Medical Center, as well as introduce to you some of the physician partners a part of this prestigious group. Now let's get today's show started by meeting Forest Park physician, orthopedic surgeon, Dr. Gerald Greenfield.
I was printer for 43 years. All the time I've been on my feet. So my legs were taking all this punishment because of walking on cement. Little by little, I started feeling them later on in life. And I knew that eventually I had to have the surgery because my knees were starting to hurt. I could hardly stand the pain.
He has a very high-level job in terms of the management he has to do for security in many areas of San Antonio, including in City Hall. And he was having problems getting around to monitor his other security members.
Once I met Dr. Greenfield, I felt so comfortable with him because he was very patient. He explained to me in layman's terms. That's what made me feel comfortable with Dr. Greenfield.
We made an evaluation. Turned out that what he was doing is having pain, the result of knee arthritis.
And I decided to go ahead and have that surgery done. And he said, well, good, because after seeing your x-rays, that is the only option that you do have.
Basically taking out the deteriorated bone where the cartilage is gone, putting in an implant that's made of metal and plastic and that is basically cemented or sometimes is allowed to, just by carpentry, grow into the knee. We can preserve people's function, replace the arthritic tissue with mechanical tissue, and then regain function.
I wanted to do one at a time. And the reason, I told him jokingly, I said, because if you don't do a good job, I want to have a good leg to kick you with. My worries were, how soon would I be able to walk? Because I needed to get back to work. And he told me, it's up to you.
Interestingly, he did better after the second knee replacement than the first, probably because he had more knowledge of what was going on. But he has had a remarkable recovery. He's gotten his range of motion back, he's gotten his strength back, and he was able to get back to doing his job probably in about 6 to 8 weeks.
I feel like a brand new man.
Forest Park Medical Centers have a completely different insight to patient care and delivery of service. In the 26 years I've been a RN and a medical director or a nursing director, I've had a lot of opportunity to deliver great service, but never been given the resources or had the mindset within the facility to really extend that 5-star treatment and service to our clientele, and that's what brings it to Forest Park. If you're in healthcare and don't have high patient outcomes, good quality, there's no reason to be in healthcare. Patients deserve the best treatment they can get, and they deserve the best outcomes we can give them. Not only are we going to give great customer service, we're going to give great clinical treatment, we're going to work as a team, we're going to be a happy family, we're going to accomplish great things here in San Antonio. The ICU and the inpatient arenas are designed in a way that are aesthetically pleasing to our clientele. We overcome a lot of the obstacles that you would find in a normal hospital or acute care setting. We've designed the facility to actually implement and accentuate the care and the service that we're giving. 5-star treatment, 5-star service in a 5-star setting.
Forest Park Medical Center is a different kind of hospital. Designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health. Our bodies need at least 90 milligrams of vitamin C per day. The best way to get all your vitamin C is by making sure to eat at least 5 servings of fruits and vegetables every day.
Cardiology is a medical specialty that deals with disorders of the heart. Dr. Jarrett McGehee is an interventional cardiologist here in the San Antonio area. Now let's meet the doctor.
My aspect of patient care is to kind of speak on the patient's level is the most important thing, I think, and then establish a good rapport with the patient, answer their questions, make good eye contact. I chose cardiology because it's a practice where I deal one-on-one with patient care in addition to procedural-based patient care. In our practice, we have a regular clinic and we do diagnostic imaging, including echocardiography. We do chemical and exercise stress tests, stress echoes, venous Dopplers, arterial Dopplers, carotid Dopplers. We go to various hospitals in the area, including Forest Park, to do interventional procedures, including peripheral vascular interventions and coronary vascular interventions.
Forest Park Medical Center, your destination to better health. Speaking of better health, up next, we're going to hear from a few of the physicians a part of Forest Park Medical Center and what it's like to be a part of this group.
I look forward to the Forest Park facility bringing a new level of patient care to the patients here in San Antonio. And when I talk about patient care, I'm talking about that thing where if you ring the call bell, how long does it take for someone to come into the room? Do you get water? Do you get pain medicine? Do you get an answer to your question? And I think that level of care and that level of concern is going to be miles above what we're seeing in standard hospitals here in San Antonio so far.
For me, this is an opportunity to give the very best care in an environment that is unmatched in the city. The hospital is beautiful. I feel that the partners are the physicians who I would want to go to. They are the ones who are providing the very best quality of care already, and they have a desire to elevate the level of care, not only for their patients, but for the whole city. I think Forest Park is going to be a leader in quality care.
Being affiliated with Forest Park Hospital allows me to give my patients a higher level of quality care. I can be involved in their case from beginning to end. Forest Park is unique in that it allows primary care physicians to be directly involved with every aspect of the patient care while in the hospital. I can admit the patients. This allows for continuity of care. I can have a close association with their surgeon. I can assist on their surgeries. I think that this will definitely improve outcomes above and beyond what the patients have otherwise for options.
Forest Park in San Antonio is a unique hospital among the system because it is the first to integrate cardiac care, cardiac catheterizations, and coronary angiogram, along with peripheral vascular care to treat heart disease and vascular disease. A common problem that a lot of medical professionals feel when they're in a hospital system is that they lack a lot of control quality. Forest Park I was attracted to because it gives medical professionals the ability to control the quality and accuracy of what medical procedures and medicine that you're providing.
I think the key difference at Forest Park is going to be about choice. It's going to be about the choice that the doctors make in terms of how their patients are cared for. It's going to be the choices that doctors make about where they want their patients to have their care, choices about where doctors want to have their family cared for. It's going to be Forest Park, and I think it's going to be an outstanding addition to the San Antonio community.
Carly has a question for Dr. Chet Nastala. If I were your sister, daughter, or mother, what reconstruction procedure would you recommend?
In general, if a patient is healthy enough to receive breast reconstruction, they have the option to use their own tissue or implants. We recommend, all other factors being equal, using your own tissue because of the benefits of having healthy, living, warm, natural tissue as a reconstruction. So whether it's a family member or anyone, I generally recommend using their own tissue if it's possible and if there are no other medical complications. I do think, though, that the best reconstruction is the one that you, the patient, are the most comfortable with. And If in your heart of hearts you would rather have a particular form of reconstruction, I think you should go that way.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
This is the Injury Report. I'm Dr. Stephen Michelsen, orthopedic surgeon with Forest Park Medical Centers. Turf toe, an injury that affects several athletes and can put them on the sidelines for weeks or even months. Essentially, what is turf toe? It's basically a sprain to the great toe involving the ligaments and supporting structures on the bottom of the great toe. The term turf toe came about with the introduction of artificial playing surfaces. The joint involved is called the metatarsal phalangeal joint. Essentially, the long bone of the foot called the metatarsal and the phalanx, or the great toe. The first joint is the main joint. It's surrounded by important supporting ligamentous structures as well as tendons and soft tissues and joint capsule. Essentially, injury to this involves varying degrees of stretching, partial tearing, or even complete disruption and dislocation of the joint. Treatment of all the injuries, grade 1, 2, and 3, involve the RICE protocol. This includes rest, icing, compression, and elevation. Also included is some anti-inflammatories, and additionally some supportive devices which may include a hard-soled shoe or a boot. Grade 1 injuries typically resolve within a week or 2 weeks. These are treated with the RICE protocol, as well as supportive taping and an insert in the shoe called a Morton's extension. A grade 2 injury is a slightly more severe injury involving partial tearing of the plantar complex. Initial treatment with the RICE protocol, in addition to anti-inflammatories, as well as taping, sometimes a hard-soled shoe or a boot for a short period of time. Range of motion is initiated as soon as the swelling decreases and the patient's able to tolerate. Progression into a regular shoe with an insert called a Morton's extension to provide increased stability and support to the great toe. Grade 3 injuries, or much more severe injuries, can be associated with dislocation as well as bony injury or cartilage damage. These sometimes are assessed more with an MRI to assess the need for surgical intervention. Patients are initially treated with the RICE protocol, as well as taping, sometimes casting, hard-soled shoe or a boot. As symptoms resolve, the patient has progressed to a firm-soled shoe with an extension, continued physical therapy. Progression to activities could involve 6 to 8 weeks, or even longer. Surgical treatment involves reconstruction of the plantar plate, reestablishment of stability of the joint, occasionally fusion and correction of a deformity. Although a turf toe injury may seem like a minor injury, it can sideline an athlete for several months, the entire season, or even potentially in their career. This has been the Injury Report with Dr. Stephen Michelsen for Forest Park Medical Centers.
If you haven't found the right doctor yet on today's show, head to our website, bestdocsnetwork.com. Click on San Antonio under the Our Doctors tab. There you will find a gallery of all the different specialties a part of Forest Park Medical Center and Best Docs Network. One of those Forest Park physicians you can find on our website is San Antonio urologist Dr. Joan Meany. Up next, Dr. Meany will be discussing bladder irritation.
When I meet a new patient, I usually ask them, when did you first notice your bladder? Because most of us walk around and our bladders are off the radar screen. But I meet a lot of patients, older ladies, younger ladies, men, where they have a sensation of their bladder all the time. There's some pressure, they have a need to urinate more frequently, maybe getting up more at night, where normally this should be quiet. Now, sometimes that could start from after having repeated infections. It can be due to stress, just like a stomach inflammation or irritation. Sometimes for women, when they have lower estrogen, even the pollens, when there's a histamine release, even up above our sinus area, it can trigger histamine release in the bladder area, which can cause a problem with the bladder lining, causing that feeling of pressure, I gotta go to the bathroom frequently. consequences of not treating this bladder inflammation, part of it is the suffering of the patient, having this bladder that's aggravating them all the time. And so it does affect their work and their family and their lifestyle. In fact, it's almost like the bladder training them, where they know where every bathroom in town is. And why would you want to have your bladder train you? You want to train your bladder. There's no long-term consequences for most people, but you want to get it treated. I have met people that have had issues from their teens or 20s and now they're in their 50s. Over time, going to the bathroom frequently, you sometimes start having a smaller bladder capacity, and that can be corrected after treatment. When I meet someone who's having problems with their bladder, I do a full physical exam and a urinalysis. We also might check an ultrasound to see if they're emptying out their bladder completely. After the exam, we talk about the different options for treatment. If we see signs of possible infection or blood in the urine, we want to treat the infection, and sometimes we can do a cystoscopy here in the office. We do have medications both over the counter, say low-acid aloe vera capsules or the prescription medicines that we use for the bladder lining. If they've been having problems for a year, 2 years, 5 years, 10 years, it might take a little bit longer on the medication. But typically everybody can return to a normal bladder almost across the board. We have very good recovery rates.
Hallie was diagnosed at our 20-week ultrasound, and what they told us is that we needed to come back because they couldn't identify her palate. And so they sent us to a perinatologist. And when we saw the perinatologist, he confirmed the diagnosis, and hers was bilateral cleft lip and palate.
When we first heard that she had a cleft, it was pretty difficult. I mean, it was very emotional. You just for yourself, the things you're going to have to deal with, but also for her, the things she's going to have to deal with her whole life.
One of every 700 babies around the world is born with a cleft lip and palate. You know, sometimes we know there's a genetic component, but the great majority of the time, it just happens and we don't know why it happens. These kids are beautiful, normal in every way, but they really don't have a chance of living a normal life unless you address their facial features. And if they have a cleft palate, they need that repaired so they can speak so that people can understand them. So what we try and do is we try and get them fixed in the first year of life. That way when they get out and they start socializing and playing with other kids, you know, they're gonna look normal except for a little scar on their lip.
When we met Dr. Hobart, it was actually our last consultation of the day, and we had thought we'd found our surgeon, and the surgeons we met with were great. I mean, we had confidence in all of them, and we're excited about what we found, and we thought, you know, we were just gonna go in and meet Dr. Hobart, and he was gonna be another good one to add to the list, and we were gonna go on home and figure it out. But we went in and we both just knew.
He was somebody that just sat there and listened to everything, every crazy question I had, and really went in depth on why he does what he does, and not just his techniques, but he also went personal, and I appreciated that. And you know, he kind of just dug deeper to where you want somebody to dig, not just everything medical. You know, there's a lot of emotions with the way your child will look, and you don't want to get that wrong, and you want to find the right person to do it. And when we found Dr. Hobart, it was very obvious that that's where we needed to be.
We like to see the baby right away because we can start forming the lip and shaping the nose so that when I do the surgery at 3 months of age, it'll get a much better result. You know, I see a lot of mothers who are 5, 6, 7 months pregnant. They've had an ultrasound that shows their baby likely has a cleft, and so they're prepared when the baby's born. I'm set up so that we can begin what we call pre-surgical orthopedics, and that's just a little simple device that helps bring the gums together, helps shape the lip and the nose so that when I do the surgery, it turns out much better. But I show them pictures of other babies, and we even give them mothers who have children with clefts that they can call up, and so it really relieves a lot of the potential anxiety and stress that can come without having gone through that process.
The result that you get after this surgery at age 2 or 3 months is what she's going to have the rest of her life. Obviously there can be corrections, but it's very important to get that right. picking a surgeon as part of that, but also just as you're going about the treatment they prescribe you, the NAM in this case, doing it to its fullest extent, making sure you're doing everything that they tell you to do, and she's not going to remember it. We're probably going to have a hard time remembering it in 20 years, but that result she gets is going to be there, and it's worth a little extra headache or a little extra hardship now for a better result long term.
We love Hallie. We love the way she looks. We think that she's beautiful. It's going to be hard seeing her look completely different after surgery, but at the same time, there's just going to be so much peace of mind that we did everything we could, and she, she's going to look even more beautiful. That's all that's all this is. You're just adding on to their beauty, inside and out. I know she's going to be a better person because of this.
Select Art I started about 28 years ago. It's a private gallery, and I specialize in providing art for public spaces and primarily doing hospitals and MOBs. And over the 28 years, I've probably installed over 100,000 pieces of art. This is my love and passion in life. My overall goal for Forest Park is to make each space unique and come up with new art concepts for each facility. So what I do is generally I start several months ahead of time once I know a facility is coming about. The art should support the design of a space, very similar to if a man buys a nice suit, then his shirt and tie should support his suit, and a lady's handbag, jewelry, and shoes should support the dress that she selects. So art's kind of like that. It really needs to coordinate and support the design of the space, yet each piece is an individual piece of art. The art for Forest Park San Antonio, I had a brand new sculptor. The folks from San Antonio were the first to see his work, and they actually selected one of his freestanding pieces of sculpture for their facility. It's a really cool kind of a teal blue steel torso of a body on a pedestal in this really unique kind of teal blue color, and that's going to be a featured piece in San Antonio. One of my artists does this hand-blown glass with a metallic finish, and they were the first facility to really have this, metallic blown glass. San Antonio got a number of new pieces that I hadn't shown before. Each facility seems to get better, and even though we think the last one we did was the best one, the next one we do seems to get even better. It's exciting for all of us to put a great art program together. And, and the day of the installation is when it all comes together. And so we get it all there and we get it placed and installed, and then it's like magic. Everything all comes together and it's like, wow, this is great, and people are excited and they're lit up, and we get compliments, the day we install it from the employees that are around, and, it's a win for everybody. So, yeah, we all just keep moving forward.
The physicians over at Forest Park Medical Center strive to find new ways to educate and inform their patients on today's health topics. Up next, we're going to hear from family physician Dr. Ramon Reyes and the Bandera Family Health Clinic as they discuss ways they educate their patients on diabetes.
In the United States, the prevalence of diabetes is around 10% of the population. That means that after age 20, 10% of the people are having diabetes. So that means that around 30 million people in the United States have diabetes. In Central Texas, the numbers are a little bit higher because diabetes and weight issues are related, as you know. And by age 50, what the number is that in San Antonio and in Central Texas, 50% of the population is either diabetic or pre-diabetic. That's an extremely high number.
Our main focus is really to provide the highest quality of care in a very comprehensive and progressive manner to our patients. What we concentrate is on a very integrated and coordinated team approach of physicians, providers, staff. We also have 2 extraordinary certified diabetes educators that are helping us with the diabetes care.
The educator here at Bandera Family Health Center is to provide the best education in a non-judgmental, safe environment. That way we aim for success in the behavioral change lifestyle for the patients regarding meal planning, activity, increasing their activity, and of course, education.
If someone came up to me and asked me who I would recommend for treatment for diabetes, I would recommend Dr. Reyes at the Bandera Health Clinic. I've been coming here for several years now, and I think they're doing a good job, and I'm trying to do exactly what I'm supposed to do.
Here at Bandera Family Healthcare, we have a team of physicians and providers and administrators that specialize in the management of diabetes. So the patient that comes to Bandera Family Healthcare to manage diabetes is managed by the whole team. And I always say the patients don't belong to me, they belong to the team and to the office. So now we have more people helping the patient with diabetes.
Dr. Reyes and the staff are always here if I need them. All I have to do is make a phone call.
Sarah has a question for Dr. Debacker. How much pain should I expect after an eyelid surgery?
Everyone should expect some bruising. If you don't get it, we're all very happy. Pain is very unusual. Pain will be present within a couple hours when the local anesthetic wears off, but that's fleeting and it should be gone within about 8 hours. Swelling is typical. We expect it. Everyone has it to some degree, some more than others, and it just depends on the patient's healing process and how they react to surgery. We use a lot of ice packs afterwards. Sometimes we'll put them on some cortisone type medications by mouth to keep the swelling down. But I always tell patients, you will have swelling, expect it. To what degree, I don't know, but it's usually not extensive.
Thank you everyone for joining us on another episode of San Antonio's own medical show, Best Docs Network, featuring Forest Park Medical Center. Now, if you're ready to request an appointment with any of the best docs you've seen on today's show, head to our website, bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com. I'm Carla Macias, and we'll see you next week.